Okay. So hello everyone and good morning. Welcome to the local Asian Hour. Asian Hour is Asia eHealth Information Network's online learning and sharing session among the members to share and explore ways on how eHealth could be improved in the region. And the local Asian Hour today is organized to address an eHealth concern. So this will be quite an informal session. We have our speakers who will lead the discussions of the topic at hand using the Cisco WebEx Meeting Center. I'm Anika Mendoza, a registered pharmacist and currently a health informatics graduate student from the University of the Philippines, Manila. I will be serving as your moderator for our live webinar. Today, we are happily celebrating the World Pharmacist Day in the Philippines. We salute and greet all our fellow pharmacists in their respective areas of expertise, both locally and internationally. We are grateful to the Asia eHealth Information Network for bringing us all together in this session. We will now be using this platform to learn about a timely and relevant challenge of healthcare today. Our time now in the Philippines is 10:41, and we are broadcasting live from the University of the Philippines, Manila, Information Management Services. Please be reminded of four things while we are in our meeting room: the platform, how to participate, the program, and the email feedback. Firstly, we are now using Cisco WebEx Meeting Center. If you are encountering problems as you participate, please log out the session and rejoin the meeting room immediately. Secondly, your mics will be on mute during the meeting, but you can actively participate in three ways: by sending your feedback, chatting your response, and posting your questions. Let's go ahead and take a moment to ensure that everyone is ready and familiar with these meeting room control panels. If you like to send your feedback, click the feedback button on the right side of your screen below the participants window. On the drop-down, you can respond by yes or no, say the presentation is too fast or too slow, appreciate the speaker with an applause, and send your virtual laughter. Isn't that cool? So if you'd like to chat your response, you can locate the chat window below the feedback button and select who you would want to chat and type your message on the chat box. The chat box panel is open for your comments as well as sharing your learning experience during the presentation. You can also post your questions by selecting the person whom you want to ask and then type your question. For this meeting, all questions should be addressed to me so I can consolidate these questions and moderate our Q&A sessions. We will be answering all questions after the presentation, but you can post them early and place it on our Q&A box or raise your hand later at the Q&A portion of our webinar so I can unmute your sound to be given the opportunity to ask the presenter yourself live. So throughout our presentation, we encourage you to interact with our speakers by typing in questions and comments using the panels provided. Now we're done on how to participate. Let's now move on to our webinar program details. On behalf of the Medical Informatics Unit, Seminars in Health Informatics, we're delighted with your presence for our webinar topic, Antimicrobial Resistance, a Call to Action. After the webinar program, you'll be receiving an email with a feedback and webinar evaluation form. We will be sending you resources such as presentation slides upon completion. We have now covered the basic things to remember for our webinar session: the platform, how to participate, the program, and the email feedback. If you'd like to join the conversations on Twitter, please use the hashtag AHIN as well as PharmacistAko. We'd love to have you connect with us and keep the conversation going beyond today's event. Also, please be reminded we are recording today's session and we will make the recorded link available via email. Now, I would like to introduce you to our presenters for this morning session. Um, we have Mrs. Leonie Ocampo and Mr. Roderick L. Selenga. Mrs. Leonie Ocampo is the immediate past president of the Philippines Pharmacists Association and is currently the president of the Asia Pacific Institute for Medication Management Incorporated. She is a BS Pharmacy graduate of the University of San Carlos in Cebu City, Philippines, with a Master of Science in Pharmacy and Master of Arts in Teaching Science. She is a consultant for pharmacy management services of United Laboratories and a number of retail outlets, a faculty member of the University of San Carlos, the Dean, College of Pharmacy, Southwestern University, and the Vice President for Operations of the Argent Business Consultants and Stores Specialist. In 2008 to 2010, she was the chair of the Continuing Professional Development Committee and the chair of the Community Service Committee. Currently, she is a member of the Technical Committee for Pharmacy Education, Commission on Higher Education, the Leatherized Education Program full of experts at SHED, as well as the Advisory Council for Healthcare of the Department of Health, the Board of Directors, Medicine Transparency Alliance Philippines, the Board of Advisors for Pharmacy, Unilab Medical Education Division, among others. She has also been a recipient of various awards, such as the Ishidate Award as an Outstanding Pharmacist in Community Practice, given by the Federation of Asian Pharmaceutical Association. Ma'am Leonie continues to redefine the roadmap of the Philippine pharmacy practice as chairman of the Board of Trustees and president of the Asia Pacific Institute for Medication Management Incorporated, and as vice president for pharmacy management services and business development of Argent Business Consultants, and as the immediate past president of the Philippine Pharmacists Association and consultant of various organizations and committees. Let's all welcome Mrs. Leonio Ocampo for the first presentation.
Okay, thank you very much, Anika. Can I be heard?
Yes,
Naririnig
hear
ba
you,
ako?
ma'am. Yes, we can hear you, ma'am.
Okay, so I would be discussing the topic antimicrobial stewardship and then the role of the pharmacist. First, I would want to quote the statement that was said by Dr. Margaret Chan during the centennial celebration of the International Pharmaceutical Federation. And she said, at the time of multiple calamities in the world, we cannot allow the loss of essential medicines, essential cures for many millions of people to become the next global crisis. No action today could mean no cure tomorrow. Now, we ask the question, what actually are antimicrobials? Of course, every one of us, especially pharmacists, know that this refers to an agent that can either inhibit the growth or kill microbes. So this could be a bacteria, a virus, a parasite, a fungus, among others. And since the introduction of antimicrobials, few decades after antimicrobial resistance already was observed, everyone knows that antimicrobials was introduced in the early 1940s when penicillin was discovered by Alexander Fleming. And unfortunately today, our antimicrobials are not as effective as they were before. What exactly is antimicrobial resistance? So it is defined as the ability of microbes to grow in the presence of a chemical or a drug that would normally kill them or inhibit their growth. These microbes also possess that natural phenomenon to adapt to external threats that they might be facing, and this is called selective pressure. Unfortunately, humans hastened this process. Antimicrobial resistance today is actually considered a public health threat. It has claimed lives and consequences is most profound, especially in children, being the most susceptible group to infectious diseases. And it also could have a very significant impact on the cost of curing patients. Now, one simple example that I could give is the cost of treating one patient with extensively drug-resistant tuberculosis. The cost of treating one could equal to the cost of treating 200 patients of susceptible TB. So we could just imagine how the cost of antimicrobial resistance could affect people. Now, antimicrobial resistance is also a global security problem today. So what do we mean by this? Now, resistant microbes actually that is present in one patient, let's say patient A, will also be the same resistant microbe that could infect another patient, so patient B. And therefore, if it would be difficult to treat patient A already with a certain antimicrobial because he has a resistant microorganism with him, that would be the same situation that patient B would be experiencing. Now, there are many causes of antimicrobial, and the table actually shows some of what were found or collected as data in the research conducted by a team from the University of the Philippines, where our very own Professor Eric Selinga and Dr. Imelda Pena were part of. So causes of this could be the health providers themselves. That includes us, especially pharmacies. There could be, we could cause antimicrobial resistance because of absence or inadequacy of treatment guidelines. If there is a treatment guideline, non-compliance to it. Also could be, it is because of poor training or no monitoring of treatment. Sometimes the very poor, organized, funded programs that actually result to a non-complete regimen given to the patient. And another cause could be the drug itself. These are things that we have to look at. Quality drug made available to patients, and availability of certain drugs because of stockouts, then poor storage conditions. Very good drugs, quality drugs, very good integrity of drugs could be destroyed simply because of mishandling while the drug is on storage. Or it could be caused by wrong dose or wrong drug combination. Or it could be the patient itself that actually is the cause of the EMR being developed. Intake and compliance issues are observed for adherence, for compliance, lack of information given to the patient, lack of money that result in an adherence and non-compliance, adverse effects, and social barriers. Thus, all these things really call or really need to call everyone to be part of the antimicrobial stewardship initiative. And this is one that would need everyone to participate in, and therefore is a real collaborative effort. Now, stewardship, we know, is conducting, supervising, or managing something, especially the careful and responsible management of something entrusted to one's care. And antimicrobial stewardship, therefore, is any activity that includes appropriate selection, dosing, route, and duration of antimicrobial therapy. It is the prudent and judicious use of antibiotics. Now, why should we be into antimicrobial stewardship? Why should we put ourselves be part of this very important initiative? Because we need to be aware that limited development of new antibiotics is what we have today. So what antimicrobials we have at present are all actually that we've got. There is fast development of resistance to antimicrobials. A lot of pathogens no longer are susceptible to all antibiotics, and we have many pathogens which are no longer susceptible to most antibiotics. Now, what are the goals of antimicrobial stewardship? Well, it's to optimize clinical outcomes and minimize unintended consequences of antimicrobial use. So examples of this are toxicity and emergence, of course, of resistance. Then reduce health costs without adversely affecting the quality of care. Now, in antibiotic use, what actually went wrong? There were treatments of infections done unnecessarily, use of antibiotics without knowing the basic principles of antibiotic therapy. Medical practitioners are under pressure for short-term solutions. Commercial interest of pharmaceutical industry pushed antibiotics, more so the broad spectrum and newer generation antibiotics. And poverty encourages drug resistance due to underutilization of appropriate antibiotics. Now, all this results to misuse of antibiotics. Antibiotics being prescribed unnecessarily. Antibiotics administration is delayed in critically ill patients, and broad-spectrum antibiotics are used too generously, or narrow-spectrum antibiotics are used incorrectly. Dose of antibiotics sometimes are given lower or higher than what is appropriate for a specific patient. The duration of antibiotic treatment sometimes could be too short or too long, and antibiotic treatment is not streamlined according to microbiological culture data results. So all of this actually are things that could escalate cost in healthcare associated with increased bacterial resistance. So there could be increased treatment failure, increased morbidity and mortality, increased risk of hospitalization, increased length of hospital stay, and increased need for expensive and broad-spectrum antibiotics. Now, what are the responsibilities of the pharmacist in antimicrobial stewardship? Pharmacists being the very health professional who the patient directly gets the antimicrobial that they want to use. So he or she is responsible in promoting the optimal use of antimicrobial agents. She is in the position, or he is in the position, to reduce transmission of infection and educate health professionals, patients, and the public on rational and responsible use of antimicrobials. So how has the pharmacist in the pharmacy sector contributed to antimicrobial resistance? So I've mentioned earlier that one of the causes of antimicrobial resistance is the health provider itself, and that does not exempt the pharmacist. So quality and availability issues of medicines. Sometimes pharmacies or the pharmacy, whoever is the purchaser in that pharmacy is, would purchase and do the selling of substandard drugs or storage conditions and stockouts, which could result to unnecessary substitution of the most appropriate antibiotic that is supposed to be going to be used. Now, how has the pharmacist in the pharmacy sector contributed to antimicrobial resistance? Another reason is dispensing behavior. So we have frontliners in pharmacy dispensing antibiotics without prescription, dispensing antibiotics without counseling on its proper use, the proper dose, the correct duration of the regimen, the need for continuous uninterrupted treatment. And another issue also is the break pack dispensing. So yung tingi-tingi na pagbigay ng isang antibiotic is one reason, without the proper information given to the patient. Then lack of consideration for patients' financial capacity, health literacy level, and cultural barriers. We have a number of drugstores operating without the supervision of the pharmacist, and dispensing in this manner is left to sales clerks without the proper training. Now, we have policies and guidelines defining the role of pharmacists in antimicrobial stewardship. Global policy as stipulated in the roles of the pharmacist released by the International Pharmaceutical Federation, the Global Organization of Pharmacies. And number two role there says pharmacists should provide sufficient health, disease, and drug-specific information to patients for their participation in their decision-making process regarding a comprehensive care management plan. This information should aim at supporting adherence to treatment and empowerment of the patient. Role number two states that the pharmacist should be proactive in reducing antimicrobial resistance by providing information about the appropriate use of antimicrobials to consumers and to prescribers. We also have our own government policy. The Department of Health, through Administrative Order 2014-0009 on rational use of medicines, has section on antimicrobial resistance policy. Number one says establishment of a plan to address different aspects of response to antimicrobial resistance. These include advocacy, regulation, and management of antimicrobial resistance and use. And the number three, under that resistance policy, says ensuring the availability, the accessibility, and affordability of quality antimicrobial medicines and their rational use. And just recently, Administrative Order 42 Series of 2014, signed by no less than His Excellency President Benigno Aquino in April 2014, mandating the creation of a duly constituted body interagency committee on antimicrobial resistance that will formulate and oversee the implementation of a comprehensive national EMR plan. In fact, right now, while we are on this discussion, the committee is also holding a meeting working on how the guidelines for the national EMR plan will be. Now, antimicrobial stewardship of pharmacies, especially in community and hospital setting, is a means to achieve balance between providing appropriate care for the individual and protecting public health. The pharmacist has to be very good in making a good balance between the two important domains in the practice of his profession. All of us know that a pharmacist has his business responsibility and he also has his technical and professional responsibility. Now, a good, effective practicing pharmacist must be one who could put a good balance between his business and professional responsibilities. So he should at least have the business heart and professional heart. And what should a pharmacist in this practice setting do? And in all other facilities where antimicrobials are made available, pharmacists purchase and sell only quality medicines or drugs. They should dispense these preparations only with prescription and should and must always educate and counsel the patient. They need to follow the dispensing guidelines, especially if they are dispensing in break packing. In closing, I would like to challenge my fellow pharmacists and students who will one day be pharmacists of this country. Let us all act now. We need to act today, for no action today may mean no cure tomorrow. Today is the World Pharmacist Day. It is a reminder for all of us of the important role we play in making it optimum health outcomes to anybody who is on medication therapy. And this is one very crucial and important role that we have to do and we have to perform if in order to be a contributor to the health and welfare of the people that we serve. So a healthy Philippines is one important thing that we need to do by making or by doing our work as a health professional. So thank you and
Thank you,
for
Ma'am
the
Remy.
opportunity of sharing this to you.
Yes,
Yes,
thank you, Ma'am
you're
Remy.
welcome, Anika.
Thank
Yeah.
you for explaining to us the roles of the pharmacist in antimicrobial stewardship and in engaging us to take this challenge. So we will now be proceeding to our next speaker, Sir Eric.
Itong kami ng Jerry.
Yan, napakinggan natin. Pwede na siya.
Um, so our next speaker is Mr. Roderick L. Salenga, a pharmacist and a master in public health. He is also a doctor of public health in epidemiology. His trainings include pharmacovigilance, International Society of Pharmacoepidemiology. He is also from the Global Health, UP, and University of Tampere, Finland, Kibuhan University, Nepal, as well as Advanced Clinical Pharmacy Practice, Taipei Veterans General Hospital, Taiwan. Let us all welcome Mr. Roderick Selenga for his presentation.
Hello, good morning to all of you. Can you hear me?
Yes, Sir
All
Eric.
right. So,
Louder, a bit louder.
okay. Thank you very much. So, good morning once again to all of you. I'm very happy to share two parts for this lecture. The first part, I will be talking about the global movements to combat threats of antimicrobial resistance. And in particular, I will be offering perspectives from the health systems. This is very important in order for us to appreciate the different activities, the different initiatives that are contributed by various sectors. But essentially for today, I will be giving some international initiatives that would cover a vast majority of countries in the world. Before I go to antimicrobial resistance per se, let us just have a very quick review of what a health system is. A health system refers to the sum total of all the organizations, institutions, and resources whose primary purpose is to improve health. And that would mean health system is comprised of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. The WHO provides a health system framework. In this slide, you would be able to see the six building blocks of a health system. You see service delivery, health workforce, information, medical products, vaccines and technologies, financing, leadership, and governance. So if we harness the power of these six building blocks, we will be able to achieve overall goals and outcomes of improved health, responsiveness, social and financial risk protection, and finally, improve efficiency. This health system framework is very useful in combating the problem of AMR in the country and internationally. I will go back to this slide later on. In 2011, in the World Health Day celebration, the main theme was combating drug resistance. No action today means no cure tomorrow. Fortunately, this theme was discussed once again in the 62nd WHO Regional Committee meeting, that's for the Western Pacific region, in October of 2011. The Philippines, in that regional committee meeting, committed to adopt and implement the six-point policy package to combat antimicrobial resistance in the country. So if you're interested, what are the components of the policy package offered by the World Health Organization? The first policy area is committing to develop a master plan to combat antimicrobial resistance. This is a very, very important instrument so that we will be able to identify what are our core strategies for implementing arrangements in order for us to ensure that we will be able to optimally combat the problem of antimicrobial resistance. The second policy area is in strengthening surveillance and laboratory capacity. The third and the fourth one are very close to the practice of pharmacy. The third being ensuring uninterrupted access to essential medicines of assured quality. And this particular point in the 6-point policy package talks about many things. For example, we have quality. Number two is the uninterrupted access. Number four is promoting rational use in medicines, in patient care, and animal husbandry. And this now reminds us that the problem of AMR is not only in the human health sector, it also very much involves the animal husbandry sector. The fifth one is enhancing infection prevention and control. And the sixth is fostering innovations and research to develop new tools and drugs. After the 2011 World Health Day celebration and the 2011 Regional Committee meeting, just recently in May, the 67th World Health Assembly passed a resolution on antimicrobial resistance, giving now a much-needed emphasis to rework on the agenda of combating antimicrobial resistance. The Philippines has committed certain actions and steps for the Philippines. Aside from the WHO framework, we also have some commitments and some important initiatives done at the ASEAN level. The Association of Southeast Asian Nations had engaged the 10 countries in the region in various activities such as a workshop on rational use of antimicrobial agents, which was held in Malaysia in June of 2013. A rapid assessment of the antimicrobial resistance in the ASEAN region will also be conducted with the lead support of Malaysia and the WHO, and also the Philippines being one of the first few countries to have completed a rapid assessment of the situation of AMR in the country. The ASEAN member states also took note of the WHO's proposal for the ASEAN member states to participate in the WHO Western Pacific Regional Office Regional Surveillance Database for AMR. In the 29th meeting of the ASEAN Working Group on Pharmaceutical Development, also known as AWGPD, held in April 2014, there were three important agreements relating to AMR. The first one, the ASEAN member states will adopt for each of these countries a national strategic action plan to be implemented at national level as deemed appropriate. The second agreement is to support the proposed regional strategic action plans subject to further discussion and include antimicrobial resistance as post-2015 agenda for AWGPD subject to the identification of post-2015 health agenda identified by the states involved in the ASEAN. It's important to note that the post-2015 agenda is now being created since the deadline or the due date for the Millennium Development Goals is in 2015. Recently, in Manila, from July 30 to August 1, there was a consultation for priority actions on antimicrobial resistance in the Western Pacific region. The main objective of this consultation is to discuss and identify priority actions to be implemented by the member states, particularly in the Western Pacific region. I think it's important to note that the priorities were given to monitoring of the extent of the AMR problem, with the importance of putting together the laboratory data and the antimicrobial use consumption data. Health systems responses, including strengthening regulatory capacity infection and prevention control capacity in hospitals and in community settings. And lastly, development and implementation of comprehensive national multisectoral plans. In 2012, we have completed the country situational analysis report on AMR, the Philippines being the first one in the region to complete this. And one of the major recommendations at the time was the surveillance system for AMR should be strengthened such that data from current surveillance programs and researches in both human health and animal husbandry are linked, translated for practical use, and utilized to guide AMR interventions. So given this, we go back to the health system framework. Of all the six building blocks, let us give emphasis to the value of information in solving the problem of AMR. We know that information can be translated to knowledge, and knowledge is power. We say that surveillance of antimicrobial resistance will help us in tracking the changes in microbial populations, which will permit the early detection of resistant strains of public health importance and supports the prompt notification and investigation of outbreaks. We know that the surveillance findings are very crucial in informing clinical therapy decisions, guide policy recommendations, and to assess the impact of resistance containment interventions. So we appreciate that the data collected will impact the way we handle the problem, both from the public and private sectors, from the national level down to the community level. Let me just share with you some of the softwares and programs related to surveillance of antimicrobial resistance. I'm sure in our audience there are many individuals who are interested in the applications of information technology to solving public health problems. In the WHO, we have the WHONet or the WHO Net, which is a free Windows-based database software which was developed for the management and analysis of microbiology lab data with special focus on the analysis of antimicrobial susceptibility test results. This software has been developed since 1989 by our WHO Collaborating Center for Surveillance of Antimicrobial Resistance based in Boston. This system is supporting 90 countries in their surveillance programs. One good feature of the WHONet is that it comes with a free backlink.
Sir Eric, you're coming. Your sound is low. It seems we have lost feed from Sir Eric. Um,
Data. We are also very interested. We are also very
Sir
interested.
Eric,
Yes.
could you please increase your volume? We have trouble hearing you.
Okay, can you hear me now?
It,
Not yet.
okay.
Can you hear me?
How about our participants? I think some of them
Hello.
are getting choppy.
Okay, can you hear
Okay, I
me?
think I can hear you. Yep, we can hear you
All
now.
right. Okay.
Pardon the interruption. Thank you.
Okay, thank you. So going back, the second part is also collecting data related to antimicrobial consumption. In the European region, we have the ESAP, which is the European Surveillance of Antimicrobial Consumption Program. This is an advocacy resource which has demonstrated that monitoring antimicrobial use patterns and even the cost can prove the crucial factor driving political commitment. The findings in the antimicrobial consumption program are used to support claims and political campaigns uh, in order to ensure that the problem of AMR is always discussed in the national and local levels. It is the interest of the Philippines to have their own surveillance system for antimicrobial consumption, and hopefully in the future we will be able to integrate two sets of data. The first data would be the set for laboratory, and the second one on the actual consumption of antimicrobials. In 2014, the WHO released an antimicrobial resistance global report on surveillance. And this particular publication can be downloaded from the WHO website. It looked into 7 common bacteria, and it covers a comprehensive picture involving 114 countries. However, there are still limitations in this particular publication, but nonetheless, countries can learn about the trends and patterns all over the world. In the Philippines, let me share with you that we are participating in the global network of antimicrobial resistance surveillance. Our very own Research Institute for Tropical Medicine, or RITM, initiated the ARSP, or the Antimicrobial Resistance Surveillance Program. This program is a Sentinel hospital-based surveillance system established in 1988. In this slide, you would see uh, the different Sentinel sites by region as of 2013. Most of the regions in the country are covered by the ARSP. And just recently, they celebrated the silver anniversary of the ARSP in RITM. Now, let me go to the second or last part of my presentation. I'd like to share with you what are the current initiatives in the Philippines to combat the antimicrobial resistance. Before going to the FDA and CPAM Department of Health activities, let me just quickly share with you the Philippine pharmaceutical market. You would see that in the whole of the market for pharmaceuticals, which is at 3.19 billion in 2013, 13.6% can actually be attributed to antimicrobials. So the total 2013 value sales of antimicrobials was 434.50 million US dollars. We still face the problem of financing, as most of our patients pay out of pocket. If you would look at this slide, we're looking now at the volume sales of antimicrobials per class. This is 2013 data, and I'd like to thank the National Center for Pharmaceutical Access and Management for these slides. You would see that the top notchers are the following: broad-spectrum penicillin, cephalosporins and combinations, antitubercular products, trimethoprim combinations, macrolides, and fluoroquinolones. In the market, the top 10 antimicrobials would include the following. Our first placer would be amoxicillin, followed by clavulanic acid and amoxicillin, cephalexin, sulfamethoxazole and trimethoprim, and the list goes on. This slide is a very important slide. The DOH has a system in place restricting high-end antibiotics to facilities which are actually only for the hospitals that are under the ARSP. So the Philippine National Formulary classifies 6 high-spectrum antibiotics as restricted products. So let me just tell you again that only ARSP-accredited tertiary hospitals are authorized to use them for appropriate indications. But you would see on the table that there are many DOH hospitals procuring these antibiotics. And if this exists in the public sector, we also feel that this is very much rampant in the private sector. So going back to the timeline, in 2012, as I mentioned, the World Health Day celebration focused on AMR and the launch of the six-point policy package to combat AMR. In the same year, we had the regional committee meeting where the Philippines had a commitment to combat AMR using the six-point policy package. In 2012, the WHO Western Pacific Regional Office committed to support the Philippines for technical and financial support. This was the same year where the AMR Technical Working Group was formulated or was instituted. This was the year when a team from UP Manila, I'm very fortunate to be part of that team. We have two microbiologists and two pharmacists on the team. We were commissioned to conduct a country situation analysis on AMR. In the same year, we had core and national stakeholders meeting that led eventually to the development and finalization of national policy on AMR. Thus, in 2014, because of the efforts that were done in 2012 and 2013, an administrative order was signed by the Philippine President. It's the Administrative Order 42 series of 2014, creating an interagency committee for the formulation and implementation of a national plan. This interagency committee is composed of the Department of Health, Department of Agriculture, Department of Science and Technology, Department of Interior and Local Government, and the Department of Trade and Industry. So here is the commitment of the Department of Health Philippines on the human health aspect. Strengthening the surveillance systems and lab capacity, creation of uniform standards on testing and reporting of the quality of drugs and diagnostics, securing the antimicrobial drug supply chain, crafting the national antibiotic guidelines, instituting infection control programs, advocacy and educational interventions, and proactive efforts towards research and development. The National Center for Pharmaceutical Access just recently launched the campaign to win the war against AMR. This is the official logo of the program. This National Antimicrobial Stewardship Program aims to ensure rational prescribing, dispensing, and use of antimicrobials in the country. This is comprised of four strategies. First, the creation of the National Antibiotic Guidelines. Number two, institute hospital AMR control strategy. Number three, support the rollout of the Philippine Pharmacy Practice Standards in partnership with the Philippine Pharmacists Association. And fourthly, public and consumer advocacy. Today, the National Antibiotic Guidelines Committee is holding its second general meeting. It had first met in July of 2014, and they are tasked to develop evidence-based guidelines on antimicrobial use in hospitals and community settings. As support to the work of the National Antibiotic Guidelines, the Department of Health National Center for Pharmaceutical Access and Management released a video which can be seen in cinemas now, talking about the AMR. And I'm pretty much sure they will be able to produce more materials in the coming months. Before I end, I just want to share with you the Department of Health Philippines and the World Health Organization Western Pacific Regional Office and the country office in the Philippines. We're working together to disseminate this pledge sheet, and we're asking everyone to participate in our campaign. We're engaging individuals, communities, institutions to pledge to use antibiotics responsibly. I hope that our participants, their friends and families will take the pledge in the soonest possible time. So I think I should end here. Let me thank you all again for allowing me to share with you what are the current initiatives on AMR. Thank you.
Thank you, Sir Eric. We thank our speakers for an intensive discussion about antimicrobial resistance and antimicrobial stewardship. We learned valuable key points and action points where we can all collaborate in pursuing the current initiatives of the Philippines. We will now proceed to our question and answer, and we will also be calling back our presenters, Mrs. Leonila Ocampo and Mr. Roderick Salenga, for our question and answer. So we have a question here.
Saan po yung
We have a question here from Ms. Christine Eileen Ching. Knowing that the resistance profiles of countries vary, how can we, as pharmacists, ensure the appropriate use of drugs when foreign standard treatment guidelines may not apply?
Okay. Can I answer that?
Okay, go ahead, Sir Eric.
Okay. That's very correct that in many countries you would see different patterns and trends of resistance. But I would like to say that there are many commonalities as well, and that's the value of sharing resources and information between and among countries. Now, the second part of the issue raised by Ms. Ching was on the actions. What do we do in case that we are only left with international guidelines which are not necessarily applicable to national setting? Well, that's the reason why it's important for ministries of health all over the world to look into the problem of AMR so that they will be able to collect local data and translate this local data to clinical guidelines. And this, I'm very happy to share with you that the Philippines is doing a serious business now in translating all of the available data that we have from the ARSP. Let me emphasize to all of you that ARSP in the Philippines has been here for the last 25 years. In terms of richness of data, we have it. So it's a matter of looking at the available international guidelines and looking at the trends of resistance in local communities. And then we translate this to very easy to follow, very easy to understand guidelines. And finally, even hospitals are encouraged to conduct their regular monitoring of antimicrobial resistance patterns. And that's the reason why they are releasing antibiograms regularly, ideally annually, and if the resources would allow them, even shorter than annually. The antibiograms will now give you an idea which drugs are applicable for use among patients who are confined within the hospital. This is very, very important, especially if we talk about nosocomial infections. And that would now bring the issue to the therapeutics committee, for example, if they need to do antimicrobial cycling or to do stop measures wherein people will not have easy access to certain restricted medications. Okay. Hello.
Thank you, Sir Eric.
Thank you.
We have another question from Jobert James. Do we have any timeline or gaano kahaba in doing projects in the community level? And what are your future actions, initiatives, projects for the community-based pharmacies?
after that, Eric?
I'll give
Anika,
Eric. Eric.
no, Anika, I will answer that question. Okay, thank you, James, for the question. The timeline actually for me is now. I don't see it having really a long timeline identified. To say every day that we delay, we are contributing to the worsening of the situation. So it is simply just committing as a pharmacist and maybe as an operator of a pharmacy. I don't know if James is an operator of a pharmacy. to allow only provision or availability of quality medicines doon sa pharmacy niya. And then these medicines that are assured of quality should only be dispensed with the right information when the need is there, meaning the prescription is available. So what initiatives, actions could we do at the community-based level? When one very basic is huwag mag-dispense pag walang resita. Then pag nag-dispense, the proper information, the proper advice should be given to the patient or the buyer paano gamitin yung gamot, and then the advice to complete the regimen. Very very important yun, lalo na community pharmacies, the one receiving most of the patients that would be using antibiotics. And then eventually we will be releasing, the association will be releasing dispensing guidelines that will go with the practice guidelines. We are currently completing the Philippine Pharmacy Practice Guidelines, which is actually led or spearheaded by Eric in the development. So isang team sila na gumagawa nito. Ang official launch actually is scheduled to happen on December 1. So pag nangyari ito, magpapalabas din tayo ng dispensing guidelines on antimicrobials. So, ang ano ko kay James, umpisahan na niya ngayon na huwag magbigay kung walang resita. At pag may resita, kailangan huwag kalimutan na bigyan ng tamang advice ang pasyente or kliyente na pumupunta sa counter ng pharmacy niya. Okay, so thank you.
Leonie. We have a final question from Kim Cherry Alter Principe. How can we ensure that all pharmacists would contribute to this action when most of them care on the amount of sales?
Wow. I don't know why these people in the first place took the course pharmacy and decided to become a pharmacist. Kasi as a pharmacist, he or she is, we are bound to really go by what we have pledged when we talk our oath. Our work is not all about business. As I've mentioned and as I have made it very clear in my last two slides, na totoo, there are two domains or there are two responsibilities that we're carrying in the course of practicing the profession, the business and the professional responsibility. But none should be put on top of the other. However, in fact, a priority is really working on helping the patient, as this is what we have committed to when we accepted or when we decided to become a pharmacist. So yung sales lang ang kailangan, I'm wondering why there are pharmacists with that kind of mindset. In the first place, I would say they do not belong or they don't even deserve to be called a pharmacist kung ganun ang kanilang ang mindset.
Yeah.
Okay, thank you, Anita.
Anita, can I also add?
Yes, Sir Eric, go ahead.
Yeah, I totally agree with what Ma'am Leonio Campo said. This is also a wake-up call for all of us to revisit the social accountability of the profession. It's very important, particularly for young pharmacists and those who are still in training. I'm referring to pharmacy students to know very well the fact that the pharmacy profession is a service-oriented profession. This means to say that people who wish to engage in the practice of pharmacy should be able to showcase their competence as medication experts with an end in mind that they will be partners of patients and communities for health and development. Anything that goes counter to those that I've said, that means to say we have a lot of work to do. We have to constantly remind each other of this social accountability. Um, Maybe when we go back home or when we go back to our workplace, we keep on reminding ourselves and our peers that we are pharmacists, not for ourselves, but for the people that we serve.
Thank you, Sir Eric.
Thank you.
Um, Thank you again for that concludes our Q&A portion. Thank you again for joining us. Would you have additional final message, Sir Eric, Ma'am Leonie?
Ah, sige, Eric, mauna ka.
Okay. First of all, we'd like to say thank you to Ahin and to Anika and Aliyah and all the people behind this webinar. This is something new for many of us, but this definitely proves that learning from each other doesn't necessarily mean we have to be facing each other like face to face. And this platform is very important. On top of that, I'd like to say it's the World Pharmacist Day today. And hopefully, if we're reminded of our social accountability, every day is actually a World Pharmacist Day. So thank you very much.
Okay. Thank you very much. I would like to thank the team, Anicano and your team, who initiated this thing to happen. And we look forward to more of this happening. And my message to our pharmacists, to my fellow pharmacists in the country is, let us all just be agents for helping the patients attain optimum health outcomes of the medications they're taking. Let us be the health professional that closes the gap between medicine efficacy and medicine effectiveness. After all, that's how we were trained for. So again, happy World Pharmacist Day, and as Eric had said, let us all be reminded of what we are for. Committing to be, or we decided to be a pharmacist. So again, thank you very much.
Okay.
And
You're welcome.
congratulations, Anika and the team.
Okay, thank you again, ma'am. You're welcome. Thank you again for joining us and participating in the live webinar. You will be receiving an email of the link to the feedback and evaluation form to allow us to improve our future sessions. Presentation handouts, review any material you missed, or simply want to go over again are also available upon completion of the evaluation forms. There will be a scheduled regional AHIN hour webinar this afternoon also at 4 p.m. The topic is about real-time cross-platform alerting system with email infrastructure. We are also inviting you to attend. Our speaker for this webinar, for that webinar is Dr. Lutz Fromberger. So please continue to check the AHIN website or the events page on Facebook for more details. Uh, in conclusion, this is Anika Mendoza, together with Mrs. Leonila Ocampo, Mr. Eric Salenga, and the support of Brian Posadas and Shai Ching from the Young Pharmacist Group of the Philippines, and the support of Aliyah Evangelista from the Asia eHealth Information Network. We wish everyone a wonderful day. Happy Pharmacist Day, everyone. Thank you.